Let's get this thing going.
Check 1, 2.
The Hip Hop Study Hall podcast with DJ Ekin starts now.
About hip hop.
Okay. So when we're talking public health, what does that entail as a major for you? Like, because I from my side, right?
Yeah.
We're in a big thing right now that I'm sure public health matters because we're all going through COVID. We're still kind of caught in this pandemic, right? Mm-hmm. As well as the big talk right now is mental health, right? Mm-hmm. So let's start with why you chose public health.
So interestingly enough, I grew up in a family of healthcare providers, and I was originally seeking my bachelor's of science in nursing. So I wanted to have that hands-on experience where I could go to work and physically help someone and just make a really positive difference in my community. And I always had that in me. But when I got to that application and when I got to school and I got to see what nursing kind of entailed, I was like, well, I still have those values, but I think I want to do something else, something that's more suitable for me. So definitely did some networking, did some research in my undergrad. And my resident assistant was an RA at the time. And I talked to her and she was public health. I'm like, hey, what is public health? Like, I don't even know what that is, but the word health is in there and it seems interesting. It seems kind of like what I want to do. So essentially, public health is very broad. That's the thing about it, extremely broad. But the main focus of it is to prevent diseases in populations. So we kind of look at the community programs, we look at disease surveillance, we look at all of the accessibilities that people have and so forth to kind of assess, okay, well, what are people using that's helping them stay healthy? What are some other things we can implement within the community to keep people healthy, so on and so forth.
Right.
So
is it more of an administrative thing or is it more of a hands-on type of thing?
It can be both.
Oh, okay.
That's the thing about public health is there are so many different jobs out there in different fields. So it can be policy development, legislative type of work, but it can also be community work. So they can have nonprofit organizations, having low-income people have screenings for healthcare, things like that. So it can be anywhere. I'm interested in epidemiology, and that's the statistical side of it, where we kind of do disease surveillance, and then we do a lot of research to see, okay, what's going on in the community, what's being transmitted, how can we help prevent this type of thing. So I think you can see how broad it is.
So with all of that being said, what has been your take as a college student that is going after the public health as a major? What has been your take on what we're going through with COVID and the pandemic?
So I reflect on this almost every day. It's pretty interesting. So I actually transitioned to public health in January of 2020.
Ah, okay.
And it was interesting because in the beginning of my coursework, we're like, oh, learning about pandemics, things like that. And next thing you know, by March, we're being sent home.
We're in a pandemic.
Yeah. I was like, wow, this is actual real life practical experience, which is kind of crazy. Not a lot of people can say that they get this, but I would say with what's going on, there's a lot to learn from that we can improve on to have not just better health outcomes, but a better life overall. Not just us here in the studio, but people everywhere in the community. I think there's a lot of emphasis on understanding the impact and importance of your health and also prioritizing your needs. And not just yours, but helping people around you too, to keep yourself and other people safe too. So I think with COVID, not just politically, but in other areas too, there's a lot that we can learn individually from it too.
Okay.
A lot.
So I have to go here.
Okay.
I just would be amiss as a host if I didn't go here. So how do you handle, or what is your feedback when you hear things like your generation, the college student? Because I mean, I'm just saying here in Tampa.
Yeah.
Man, they don't care because they don't think they're going to die. It's a cold, man. I got the flu. I'm going to the party.
Oh, they call it the spicy flu.
Yeah. Like, what is your take when this is your major?
Yeah.
And I'm sure you've got friends that are also in this major.
Okay.
But I'm sure you've got friends too that are like, man, I'm not staying in. I'm going. And in their defense, Florida kind of been wide open, right?
Yeah.
So how do you handle both sides of that? Being a college student, having friends that you guys are in that stage of life where we're having fun, we're experiencing college, but you're also dealing with public health as your major, and you're seeing stats, you're studying this kind of stuff. How do you handle that?
That's a really good question. So for me, anytime I approach a situation whether it be social or even academic or anything like that, I always try to say, okay, well, what can I do to keep myself safe so I don't get anyone else sick type of matter. It can be a little hard, like balancing having that social aspect, because essentially socialization is an important aspect of mental health. We are creatures that are designed to be able to socialize with other people. And when that's taken away from us, that can be hard because we're not really used to being put in situations like, oh, well, I actually can't go out, So I think it's definitely a learning experience, but throughout this process, I've kind of learned to do what's best and to know that some situations are absolutely temporary. So it's important to know, hey, if you are sick, it's okay to stay in for 5 days. Like, it's okay. You know what? You can look forward to getting back out there when you're better type of situation.
But did you have a lot of friends that were just like, man, I'm still going out? Or did a lot of your circle of friends? And I mean, not to get all in your business, but I am all in your business. But
I'm going to expose them. I'm just kidding. I'm kidding. So funny enough, a lot of my friends are actually, they're not public health majors, but they're seeking medical degrees and things like that. So they have that mindset like, okay, well, we're like burnt out. They're learning a lot. It's kind of a lot for them. So I think their perspective is a little bit different considering their educational background. But I've had some conversations like, hey, maybe you probably shouldn't go out type of thing. But at the end of the day, I think that they have the right to exercise their autonomy. And in my eyes, I just hope that they always do what's best.
So in your eyes, is COVID as serious as everybody's talking about? Or did the media make it more scarier? Because here's the take, right? And we've talked about that a lot on this pod, right? On the one hand, I am very much a believer that COVID does exist. I am very much an advocate of, wear your mask. Like, I'd rather be safe than sorry, right? And at the same time too, I also don't want to get someone else close to me that I care about, as well as somebody that I don't even know. I don't want to be the cause of someone else getting sick, right? I don't want to be that person.
Yeah.
But there's also that thing of, we haven't, like here's my thing. Let's talk the news and let's talk the media, which I am, right? If I gave you stats every single day on somebody with the flu, and every single day that's all I did was 1,700 more people caught the flu today.
Yeah.
1,627 people caught the flu today. 1,937 people died from the flu. You understand what I'm saying? Yeah. If I did it like that, and that to me is what it's starting to feel like with COVID, right? And you read all these different things, like you said. And again, I don't claim to be an expert. I've had physicians on, I've had people on that are in the medical field, and you're my first person of someone that's studying it now. You know what I'm saying? So your opinion matters to me. But do you think it's more so a lot of, not that COVID doesn't affect you, not that it's not even bad, but if the media wasn't on it the way that they are, do you think it would be as bad as it is? Because are we all, and even this part, and this is a twofold question, are these people really dying from COVID, or are they dying from what else they had and COVID might have just escalated it?
Yes. So I'll address the media first. Okay. I will say media has played a huge part.
So you don't like us is what you say? No, I'm playing.
No, I didn't get there yet. I'm just kidding. But there's definitely some sort of fear that's instilled in people when they see things like this online. And sometimes they kind of put this stuff out there to kind of hope that people will take it more seriously, but it's doing more harm than good.
I know you're trying to get it, all the latest and greatest content from Hip Hop Study Hall, right? You're trying to get your hands on that? It's DJ Ekin, man. Don't forget, hit that subscribe button, all right? Get the alerts. Hit that subscribe button now.